So I'm going to talk to you today about the uptake of the Alberta Nutrition Guidelines for Children and Youth in recreational facilities. Now, in response to the need, next slide. In response to the need to improve the rec facility food environment, the Alberta government released a set of guidelines in 2008, and these guidelines were voluntary, and they're intended to facilitate children's access to healthy foods and beverages in a variety of settings, including rec centers, childcare, and schools. And just a note about the abbreviation on the slide, you will see ANGCY throughout my slides, and that just refers to these guidelines. So I'm going to talk to you today about two studies that we did. In the first study, we were interested in studying the extent to which rec centers were actually using these guidelines. And this study has been published in BMC Public Health, and the reference is listed on this slide. So the purpose of this study was to assess awareness, adoption, and implementation of the guidelines in rec centers, to describe barriers to adopting and implementing the guidelines in rec centers. Now I'm going to be talking about two concepts, adoption and implementation. Now adoption is that simple mental decision that you're actually going to use guidelines, whereas implementation is action-oriented, and it refers to the steps taken to put that adoption decision into practice. So to do this study, we conducted a cross-sectional telephone survey with managers of publicly funded rec centers in Alberta, and it was done about 1 year after the guidelines had been released. To recruit the managers, we sent out letters to a random selection of 408 of the approximately 1,000 publicly funded rec centers in Alberta that actually serve food, and we were telling them about the study and asking if they wanted to participate. Now, it turned out that only 151 facilities were eligible and would also agree to participate. So our participation rate was 15%, and the response rate was 41%. So the questionnaire was designed to be completed in less than 10 minutes and included 10 closed and 7 open-ended questions to assess awareness, adoption, and implementation of the Alberta Nutrition Guidelines. And some examples of the questions we asked are listed on this slide. We use chi-square tests to examine the relationship between the independent variables, such as the priority of healthy eating, with the dependent variables of awareness, adoption, and implementation of the guidelines. Now, our results were interesting, and they showed that 1 year following the release of the guidelines, only one half of managers surveyed had actually heard of the guidelines. 14% of facilities were classified as adopters, meaning that they had made a mental decision to use the guidelines, but only 6% were deemed to have implemented the guidelines. And sorry, it looks like the bottom of my slides got cut off, but the third bar is implementation. Now, adoption and implementation of the guidelines were more likely if there was a champion who was actively promoting the guidelines, if their priority for healthy eating had increased over the past year, and if the facility had nutrition policies. Now, the next slide shows the nutrition policies and practices of the facilities that participated in the survey. And I'm just going to highlight two key findings here. If you look at the middle bar, you can see that very few facilities had nutrition policies. The red shows the proportion that do not have nutrition policies. But if you look at the bar immediately to the right of that middle bar, you can see that nutrition was clearly on the radar, as half had made changes to improve the nutritional quality of foods in their past year. The key barriers to following the guidelines were primarily financial. So first, managers feared that offering healthy foods would reduce profitability because healthy foods were perceived to be more costly, to have shorter shelf lives, and to take longer to prepare. One manager said very clearly, "It's too expensive to serve healthy food." Second, managers believed customers did not want to buy healthy foods. As stated by one manager, unhealthy foods are big sellers. Fried foods like French fries are cheap to buy. People have a perception of what foods they want. If people are watching a hockey game, they want burgers and fries, not a salad. The operator needs to provide the foods that people want. So the findings of this study showed that awareness, adoption, and implementation of the guidelines were low among this sample of rec centers about 1 year following their release of the guidelines. Now, there's several reasons why this might be. It could be related to the way the guidelines were distributed. And this was primarily by mailing out the guidelines to municipalities, by giving presentations at conferences, and posting the guidelines online. These strategies may have been inadequate. As well, Alberta did not have a formal supportive program like BC. So the results could have been different if Alberta had followed BC's approach of providing training, support, resources, and seed funding. But at the same time, we do know that policy diffusion is a very lengthy process. So given that our survey was early, it was only 1 year after release, our results might really not be that unexpected. Diffusion of tobacco control policies, for example, took many, many years. We also found that champions were very important and that the primary barriers were related to perceived lower profitability of healthier foods and incompatibility with customer demands. So overall, these findings really showed that we need to develop a better understanding of the barriers to using nutrition guidelines. So in our second study, we explored these barriers in an in-depth manner. And the results of this study are published in 4 separate publications, and I put the 2 most important publications in red. So the primary purpose of this study was to explore the factors that influenced adoption and implementation of the nutrition guidelines within rec centers, and we also compared the availability of healthy foods between rec centers that had and had not adopted the guidelines. So to accomplish these objectives, we performed a mixed methods multiple case study in which we purposefully selected 3 cases. So the first case was a full adopter. This was defined as a facility that had adopted and implemented the guidelines in its vending machines and concession. Then we selected a semi-adopter. The semi-adopter was a facility that had adopted and implemented the guidelines in its vending machine but not in its concession. And we selected this semi-adopter because we felt it would highlight factors that influence adoption and non-adoption within a single case. Finally, we selected a non-adopter that had not adopted or implemented the guidelines in any way. Now, we were studying both adoption and implementation, but for simplicity, I'm going to refer to the cases simply as adopters and non-adopters. And I'd also like to highlight that recruiting for this study was extremely difficult, and we could actually only find 1 full adopter within the province to participate in this study. So qualitative data were generated through semi-structured interviews with 12 managers, including rec center managers and managers from industry who were contracted to provide food services within the rec centers. We also recorded observations in all facilities and reviewed documents pertaining to each case. Then we assessed the food environment using 2 scores. First, we assessed the availability of healthy items by using the Nutrition Guideline food rating system to classify items within concessions and vending machines as healthy and unhealthy. And then we also assessed the nutritional content of all items within vending machines to derive an average nutritional profile of vending machine items for each facility. So then we had to do a cross-case analysis, which meant we were comparing the results from all 3 cases. Now, we found that the full adopter and the semi-adopter were very similar in many ways. And so we grouped these 2 as adopters and compared and contrasted findings from those 2 cases with that of the non-adopter case. So to look at the patterns for the qualitative data, we identified facilitators that encouraged nutrition guideline uptake and barriers that discouraged uptake in adopters compared to the non-adopter case. And for the cross-case analysis of the quantitative data, we compared the food environment scores between adopters and non-adopters to see if adopters had healthier food environments. And then we summarized our final findings in a cross-case report. So the first key finding that emerged was that rec center managers were gatekeepers of the food environment. Their knowledge and beliefs shaped their decisions and actions related to the nutrition guidelines. So adoption and implementation of nutrition guidelines was more likely when the manager personally valued healthy eating, was not only in charge of food service, but had a much broader scope of responsibility that included ensuring the facility achieved its wellness mandate, had a positive view of nutrition guidelines, perceived a high need to improve the facility's food environment, was willing to champion changes that actually went against industry norms and that were financially risky, and when the manager perceived few competitive pressures from other stores and restaurants. Managers' perspective of finance was particularly influential because most rec centers depended on revenues from the sale of unhealthy foods. All of the managers, adopters and non-adopters, perceived that selling healthy food was not as profitable as selling unhealthy food. But what set adopters apart was that they were willing to take some small financial risks by making small changes to improve the food environment. For instance, they replaced regular chips with baked chips, added veggies and dip to their menus, and made whole wheat the default option for sandwiches, wraps, and pizzas. Adopters were not, however, prepared to make much more financially consequential changes, such as removing popular items like fries and poutine from their menus. The non-adopter, by contrast, was not willing to make any changes that might pose even a small financial risk. The second major finding that emerged was that although managers played a major role in adopting nutrition guidelines, they could not accomplish these tasks alone. Intersectoral collaboration with schools and industry were also absolutely essential. So in terms of partnership with industry, this is essential because most rec facilities contracted out their food services to private companies, so they had no experience in food service delivery or in using nutrition guidelines. So to use the nutrition guidelines, rec center managers required the full cooperation of the companies that provided the food services within their facilities. Next slide, Bill. In all cases of successful adoption, partnerships with industry were formed. And these industry partners were already using the guidelines in their school-based operations. Adoption did not occur when industry would not partner with rec centers, and the companies that did not agree to partner were not using the nutrition guidelines in schools. So efforts to improve the school food environment provided a supportive context and capacity to implement similar measures in rec centers in several ways. First, adopters in our study did not actually learn of the Alberta Nutrition Guidelines from other rec center managers, but from others within their social networks who were using them in schools. And second, as I already mentioned, industry's willingness to implement the guidelines was partially determined by their pre-existing capacity to implement nutrition guidelines developed through using them in schools. Now, if we look at the food environment results, we can see here that if you look at the food vending machine rows, the availability of healthy items is listed there, and you can see there's very little difference across the three cases, and it's very limited in most cases. And that was really because there's just very few items available that can be sold in unrefrigerated food vending machines that meet the definition of healthy. You can see there's a little bit of difference in terms of the average caloric profile of those items, with the non-adopter having a very high, more calories in their items. Now, if we look at the beverage vending machines, you can see that there are some differences there, where the non-adopter had very limited availability of healthy items, and the full and semi-adopter had much more availability of healthy items. Primarily, this is because water is one of the top sellers. And in the concessions, you can see that you really can't tell the difference between the adopters and the non-adopter. Now remember, the semi-adopter did not adopt the nutrition guidelines in its concession. So here we're comparing one instance of adoption, which is the full adopter, and they had a 16% availability of healthy items, but that was really not higher than the availability of healthy items in the non-adopter. So in conclusion, the key factors that influence adoption and implementation of provincial nutrition guidelines were really related to managers' beliefs and knowledge regarding nutrition guidelines, and especially their willingness to take financial risks. Multi-sectoral partnerships and linkages were also very highly influential. And the food environment was not markedly superior in facilities that had adopted the nutrition guidelines. So the implications of our findings, they suggest that to increase the use of nutrition guidelines in rec centers, it is important to improve managers' perceptions of nutrition guidelines. Now, one way this might be done would be through a demonstration project in which one facility actually adheres to the guidelines, and then facilities can observe what the results are from following the guidelines. We also seem to need some mechanisms to facilitate intersectoral partnerships, especially between the public and the private sectors. So this might be done through, for example, financial incentives to encourage partnerships. If the government could provide perhaps lists of companies that are willing to offer healthier items, or through joint events and conferences. Now, if voluntary adherence to nutrition guidelines continues to remain low, government should consider financial incentives for companies that develop healthier foods, for companies that succeed in selling a high proportion of healthy foods, and as well for facilities to continue to receive a portion of their public funding. Mandated policy may ultimately be what is needed because it reduces the risks associated with complying with nutrition guidelines by leveling the playing field for all facilities and for the private companies that operate within them. If mandated policies are introduced, they must be quite specific. In Alberta, our current standards are weak because they don't have specific targets for what percent of foods can be healthy and unhealthy. And policies could be phased in over time to allow more time to implement them. And I just want to acknowledge my co-authors, Dr. Linda McCarger, Dr. Kim Rain, and Dr. Laki Gunwardine, and our funding from the Canadian Institutes of Health Research.